Hi everyone, welcome back to my channel. In today's video, I'm going to be talking about toxic shock syndrome. And I know it's probably not everyone's favorite topic to talk about, but I think we need to talk about it because it doesn't only affect people with periods. If you're like me, you probably grew up fearing toxic shock syndrome. I remember being so scared of it when I was using tampons. Like, the anxiety was real. And I remember no one else was ever really scared about it or talked about it because a lot of people just assumed that it was something that only menstruators got. Like, if you had a period, you had to be careful about it. But if you didn't have a period, you didn't have to be careful about toxic shock syndrome because it wouldn't affect you. But that's not right. Anyone can actually experience toxic shock syndrome. Now, the reason why toxic shock syndrome can be experienced by anyone is because it happens when certain staph bacteria enter the bloodstream and produce toxins. Although it has been linked to tampon use, it can actually affect anyone. And the reason for that is because anyone can have like staph bacteria and a staph infection. And if you have a cut or a burn, that's a very easy way for staph bacteria to get into your bloodstream. The other big cause of a staph infection is surgery or childbirth. So childbirth can actually cause toxic shock syndrome. There's also the fact that you can have a viral infection that causes you to have staph bacteria, which could then shift to toxic shock syndrome. It's crazy. And you know, I grew up not really knowing this. I had no idea that like anyone could experience this. Now, of course, tampons have been linked to toxic shock syndrome and also contraceptive sponges as well as cervical caps and diaphragms. If they're worn for too long, they have also been linked to toxic shock syndrome. So that's really important to know because I never knew that those things were also linked to toxic shock syndrome, and I know that those things are very popular forms of non-hormonal birth control. Now, the reason why toxic shock syndrome has been linked to tampons is because researchers believe that when you insert a tampon, some people may experience little micro tears in their vagina, which could lead to staph bacteria getting into your bloodstream. So if you wear a tampon and you get these like little micro tears and you leave the tampon in for too long and it starts to harbor bacteria, that bacteria can make it into your bloodstream, and then that is how you get affected with toxic shock syndrome. So while toxic shock syndrome is rare, it still happens today. The symptoms would be a very high fever that just kind of randomly comes out of the blue. Low blood pressure, that's a huge factor. So, you know, if you have like this sudden spike in fever and then you're on the couch and you try to get up and you're really dizzy and woozy, that can be a sign of low blood pressure. Other symptoms would be confusion, nausea, rash, which the rash usually shows up kind of like a sunburn on your palms or your feet, but it can appear in other places of your body, as well as body aches and seizures. So if you are experiencing any of that, it is best to get your butt to the hospital. If you don't go to the hospital or get medical help quickly, then toxic shock syndrome can lead to death. Like, it progresses really quickly. Now, symptoms of toxic shock syndrome can appear pretty quickly, usually within a couple days, up to 5 days, after surgery or even after your period. This is when the symptoms can appear, but they can actually appear pretty quickly. It kind of just depends on the conditions and what's going on in your body. So that is why it's super important to understand the symptoms so you can learn the warning signs and then seek help if you're experiencing them. Now, there are a lot of things that you can do to prevent toxic shock syndrome or like staph infections, and that is just keeping cuts and burns and any wounds clean and changing dressings often, making sure that you wash your hands before you are like touching any open wounds or anything like that, or if you are touching and using period products. Hand hygiene is just so important for everything. We all know with everything going on in the world how important hand hygiene is because your hands, they can have some nasties on them. So washing your hands, really important. And when it comes to menstruation, it is so important to change your tampon at least every 8 hours. Now, if you are someone who sleeps with a tampon in, I highly recommend looking into like overnight pads or period underwear. You can also wear a menstrual cup. You can wear them for a much longer time than tampons, and if you are changing them every 12 hours, they don't carry the same toxic shock syndrome risk. And with all of that being said, I just want to let you guys know that if you've had a staph infection in the past, it actually predisposes you to toxic shock syndrome. syndrome. So I hope you guys learned something in this video. I know I learned something while making this video, and that is why I'm here. I want us to just learn together. It's so important. And if you guys have any questions, let me know in the comments below. I really, really appreciate your support, and I just want you guys to know that your cycle matters, and I will see you in the next video. Bye!